Hi, everybody. Welcome to this week's Connie Chat. And this week I have Dr. Mark Tanaka joining us. Dr. Mark Tanaka went to Harvard for undergrad, then medical school at the University of California at San Francisco. And then he completed his emergency medicine residency training at Cook County Hospital. And currently he is the emergency physician at Kaiser Permanente in Northern California. Hi, Mark. How are you?
Doing okay, hanging in there. How are
Good.
you doing?
Good. Thank you for joining us. And for those of you watching us today, I just want to let you know that I knew Mark when he was doing his residency here at Cook County, and we've been friends for over 20 years. And whenever there's something going on here at the Dornan household, usually I'll text message Mark, hey, what's going on? Do you think I should go to the hospital? So he's a friend, a very good friend. So thank you for joining us this week.
My pleasure.
So now, the reason why I have Mark joining us this week is because Illinois shelter in place is going to be lifted in the next week or so, and a lot of people are very concerned. How do we look at houses safely for a lot of the buyers that are out there that really want to move right now, but they're worried about, they've got health concerns. And we also have sellers that are, living in their homes, and they have their own health concerns, having all these kind of strangers coming into their homes. So Dr. Tanaka, tell us, what are some tips and advice that you have for us?
So specifically for people entering the real estate market,
Correct.
it's the same advice as always, although the opening up of parts of the economy and society as a result of flattening the curve enough is a good thing. The virus is still the same and it's still out there. It's not gone. This pandemic is not over. So it's important that we continue the advice that might seem almost like an over, beaten cliche, but it's not. It's sound advice. So keep your distance, 6 feet at least. Wash your hands frequently. Don't touch your face. Wear masks when you can't keep that distance, and keep surfaces clean that people may be touching or breathing on.
Correct. So Mark, what I've been telling my own clients, so on the buy side, when I'm touring with clients, even though that they're wearing their masks and they're wearing gloves, I'm still encouraging, hey, let's try to remain 6 feet apart at least and do some social distancing. And even though that you are secure with gloves and masks, still try not to touch anything in the house. And if you need something opened, I'll open it for you, because I've got my car chock full of Clorox bleach and all sorts of other things in there and disinfectants. So do you think that I'm perhaps going a little over the top, or do you agree with that?
I mean, in general, you just want to be safe because it's easy to slip up. Just as, for instance, not touching your face, it's not something that people are generally aware of, and only with what's happened just in the last few months have people been forced to have an awareness of this. I mean, look, if you go into a house and you have clean hands and you've washed them properly, touching an object's probably not going to put the virus there that someone else is going to catch by touching it, especially if it's, a day or two later, correct?
Right.
So, but in general, just err on the side of caution. That's what I would say.
Right. Out of curiosity, what do you think? Because there's so much out there from people saying, well, take this medication, this antiviral medication, and this will help you not get the virus or prevent you from having the virus. And then there's other folks that have stated stuff like, well, even when you enter the house, and if you're not wearing an N95 mask, the virus can hover in the air. And I've had questions like this from clients, and I don't know how to respond to that other than just take every precaution. I don't know if the virus is hovering in the air. What do you think?
It's been found that there's some really smart people working really hard to study these things, and it's hard for even a physician on the front lines, intimately connected with this whole problem, to stay abreast of it. So we could talk about this for hours, but we don't have that time right now. So again, I wouldn't get too paranoid unless unless it's not an open house that you're taking people to with 50 people coming in within an hour or two, right? These houses are being shown privately with you, so I wouldn't get too paranoid about it. But again, keep these precautions. In terms of these preventive medicines and cures, I mean, nothing has yet been shown to be fully effective, and at least one of those medicines does have some serious side effects. So I'm not on any prophylactic medication regime myself, and I wouldn't advise it.
Okay, good.
But
Yeah.
I think people should just, I might be a little biased. I'm a trained medical physician, so I think the public should take the advice and cues from trained medical and public health professionals.
I couldn't agree more with you, Mark. Now, tell me a little bit about what you're seeing there in Northern California right now. Do you have a lot of cases in the emergency department?
Um, well, we've done a really good job in California. I really do appreciate the concerted and coordinated effort um, from the start and very early that our governor and his staff have put together. So the curve in Northern California, especially, has been flattened. So we haven't been overwhelmed the way some parts of the country have.
Mm-hmm.
So we're really fortunate, but we're not through this yet. So we can't be complacent, but our ICU and hospitalization cases we've kept them under control. And as you may have heard, a lot of people are avoiding the emergency departments for other problems from fear of contagion. So in many ways, the workload outside of these infectious cases has actually been less than normal.
Interesting. I've got another question for you. So until a vaccine is found, I mean, we're all at risk. I mean, and more than likely, we're all going to be exposed to this, right, after shelter in place. And this is going to be around for a while. So do you suggest that we kind of continue with these protocols for showing homes, et cetera? Do you even advise open houses to start commencing open houses on a very limited basis on how many people enter the house at any one time?
I'm not going to make policy for your profession in the real
I'm not
estate, but I would
Sure.
follow, given that there's variation from place to place that may or may not be appropriate, given that there are regional geographic variation in the epidemiology of the
Sure.
disease. I would follow the advice of your local and state protocols put out
Right.
by your public health agencies.
Have you looked at Illinois' numbers at all? Do you feel that Illinois has flattened the curve?
A little bit. I don't follow it too closely, despite having lived there 4 years of my life. I know that Chicago is pretty hard hit, and I know from the news that now, a lot of rural areas that are maybe opening up faster are going to start getting hit. And the issue there is that hospitals and resources are relatively scarcer in many of those areas. So I'm sorry, did I answer your question?
Yes, you did. Thank you, Mark. I appreciate it. Any parting words for our audience out there for today?
And as I usually say to patients, stay safe, stay sane. I think I've I've developed an appreciation for a lot of simpler things in life and relationships. As much as we can't see each other and be with each other, give physical affection and hugs like we normally would. But I'm just very thankful to be in the place that I am. I know this is very, very hard and probably devastating to many people in our country and around the world, people who have less, financial means and resources, or they're just in a bad place and they can't, they're not in a position to be able to adapt properly to what's been going on. So, I, not to wag my finger or anything, but if you're, please everyone count your blessings and be kind to each other.
I couldn't agree more. And you know what? I will tell everybody out there, Mark was one of the first people to reach out to me when this corona started happening and messaged me to make sure that I was okay and taking precautions out there. So thank you, Mark, for your friendship. And believe me, I've been counting my blessings every single day. I'm very fortunate.
Thanks so much, Connie.
No, it was so good to see you. Say hi to the family for me. Thanks again for joining us.